Check, check, 1 2 1 2. For the people watching this on the playback, you're tuned in with your host, Deshaun, aka Son of a Jones, one half of Envy Online. And today I got a special guest with me. I actually got my family member, my cousin, Robert Ivy from Mississippi. Robert, before we get started, man, how's your day going?
Man, everything going good, cuz I can't complain.
All right, man. Now I appreciate you coming back, man. For the people that's gonna watch this, we had to shoot this interview twice because on our end we had some technical difficulties. So I was telling my cuz, I was like, man, we gotta get this done right because I believe this topic is very important. Now, for the people that's gonna tune in, normally I talk hip hop music and sports and stuff along that lines, but we're gonna deal with some health today, especially as black people, because the topic that we're gonna talk about mainly affects us as African Americans. March is an important month for two reasons. So, for the people who may not know, March is Women's History Month. So, first, salute to all the women out there in honor of Women's History Month. But March is also important for Kidney Awareness Month as well. So, the topic we're going to be discussing is kidney disease, and I have the honor of talking to a survivor of kidney disease, somebody who's actually had a transplant, which is my cousin. So, Rob, again, man, how's everything going your way?
Man, everything going good, cuz just taking one day at a time. How about you?
Hey, hanging in there, man. And I'm glad to be having this discussion because I feel sometimes that we shy away from discussions like this as men. We don't like to talk about it, but it's important because maybe it might help somebody. Maybe it might
Right.
cause somebody to get their stuff checked and save a life.
That's correct.
So, I started off like this last time, going over some stats dealing with kidney disease. So there's an estimated 35.5 million Americans with kidney disease. And as you told me last time, you said the majority of those is African Americans, if I'm correct.
You're correct.
And about 815,000 are living with kidney failure, which is different than kidney disease. Nearly
Right.
500,055,000 Americans are on dialysis. Kidney disease has grown at alarming rates, affecting more than 1 in 7 of American adults, with pretty much people of color, pretty much us, at the majority of risk. There were 131,000 Americans newly diagnosed with kidney failure since 2022, pretty much yesterday. And 9 out of 10 people with kidney disease are unaware that they have it. So, Rob,
Right.
Rob, I want to ask you. I just listed off the stats, and obviously you know them because you dealt with this stuff all your life. Um, Before you was diagnosed with kidney disease at an early age, were you aware of these stats out here?
No, I wasn't aware of 'em because we didn't have social media. We didn't have social media. So even though I growed up around my mom having kidney disease, I still was uneducated about the disease. I really got in tune with it after I had my transplant and started my kidney foundation. And that's when I started to educate myself about the deadly disease.
All right. So, for the people that's going to tune on this that's unaware of what kidney disease is, can you briefly describe it for them?
Well, chronic kidney disease is they often call it a silent killer or a silent disease. And you might not know you have it until it progressed. Just like me, I found out that I had kidney disease, which that was in the early stage. But kidney failure, like when my sister found out she had kidney failure, that's when you had to start dialysis.
So, in a prior interview that I watched of you that you did a while back, you talked about the role that genetics played in kidney disease. Can you briefly take us through growing up with one of your parents suffering from kidney disease, and how was that for you growing up?
Well, like I tell people, we had some great times, but at the same time, you can't help but to feel seeing your mom get off dialysis, or she can't do what other people do. because mainly she'd be sick. We had a lot of close calls to death. And, when we were smaller, our mom would go to the hospital for a long period of time. So my dad would take over our auntie house, because he was in our life and he was aware of what's going on. But 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 you still have to have somebody to watch your kids, and that's what it did. But like I said, it like I said, it was a hard time.
So as I started off talking about March being Women's History Month and pretty much us showing appreciation to the women in our life, you briefly talked about your mother and what she meant to you. If you could share a moment, what was your best memory of your mother growing up?
Man, the best member of a mother, she was protected. She was protected over her kids. That's the main point. She always worried about us and took care of us. Even and we had a grandfather living with us, and at the same time, she was able to get off of dialysis and still be able to take care of her family. So we were young, and she used to drive and ride us around, but then after a while, she stopped driving when we got older. But I can say, but I, but I can say one thing. But I can say one thing about the whole thing, Deshaun, is she loved her kids. She was gonna make sure we ate and different things like that. And like I said, it wasn't all bad time, but seeing one of your parents just real be sick all the time, it was something different.
So one of the things that me and you talked about when we were discussing setting up this interview, you was telling me how this topic really isn't accessible or information accessible for Mississippi. You said if this was a topic on cancer, more people are aware of topics on cancer as opposed to kidney disease. And I believe I posed a question to you. Um, what do you think that they can do to help this information be more accessible in schools? Do you think like topics like this need to be taught about in elementary, middle school, and high school? Because it's a problem to live in
I,
a
I, I
state with a
think
high population like that and not know about it.
I would say yes, Deshaun, because you know as I look on TikTok, as I go live on TikTok and stuff, and I see different people, the younger generation, you have babies that's on dialysis
Mm,
as babies.
wow, I didn't know that.
And then you have a lot of younger people that don't know anything about, they don't know anything about high blood pressure and things. So you have people 25 and 20 on dialysis. So I think it'd be better for us to have this in the school, because when I was growing up, we always looked at the older people were dying, the older people were getting sick. You know what I'm saying? You know that was common back then. But now you have babies, you have teenagers, you have a lot of people diagnosed with high blood pressure and diabetes at the age of 9. So I think, I think we should they should put it in schools and teach the kids. Like I said, you have a lot of them on dialysis right now, younger people that didn't know anything about high blood pressure and diabetes. So yeah, that'll be a good subject in school.
Now, even outside of school, you just brought up an interesting point. You said TikTok, and I know that a lot of older people think TikTok is for the younger kids, and to somewhat it is. But boy, have I learned a lot of stuff in general on TikTok. And I see
Yes.
the great work that you're doing on TikTok. You're helping people out, you're letting them share their stories and testimonies. Can you briefly talk about how TikTok has helped in a way for you to spread the message and reach out to people who are dealing with this and maybe they didn't have hope or didn't have information, but because you have TikTok, you're pretty much creating a community to spread the gospel in a way.
Yes. Well, when I first got on there, Deshaun, I really didn't, I was waiting on 1,000 followers before I can go live, but I took some time off. I didn't understand. I really didn't know what to talk about. So when I started back, getting on TikTok and I was sharing my story and stuff like that, and you know, I've met I've met so many people. It's like another world. It's like another world that I stepped into. And like the statistic that you read a few minutes ago about kidney disease, I knew all of that, and I knew I knew people's on Facebook, and I knew people on um, Instagram.
Hmm.
But man, I'm just talking about the community just on TikTok. Man, it's a bunch of us. So I decided I decided well, what I'm gonna do is I'm gonna share my story. Sometimes you can't do it alone when you're trying to reach people. So
Hmm.
I have people come on my platform just to give people hope because you have a lot of people saying that I just found I had kidney disease. I just found out I'm in kidney failure. I got to get on dialysis. So the unknown. So and they be scared, they be angry because their life can change. So that's what I try to do. I try to get people on there to give people hope, and encourage people to get a checkup, because it is very important. I done talked to a lot of people that say, "Well, I wasn't feeling good at work." Found out found out they was in kidney failure.
Wow.
Some ladies say I thought I was pregnant. Some people say I thought I had the flu. Just all type of things that we think that we know what's going on with us, and come to find out it be kidney failure.
Again, man, big up to social media when it's being used right. Because I know, again, kids do dances and challenges, but to have that to have that piece of technology bring us together like that is amazing, man.
Yes, it's amazing.
Now, you talked about when you dealt with kidney disease, you were fairly young. So, one of the things I want to ask is what were some maybe warning signs, if you saw the warning signs or felt the warning signs, um, that made you know, like, hey, I need to go to the doctor and get a checkup?
Well, I didn't know. That's that I didn't know that I had high blood pressure. I didn't know that I didn't know anything. Only reason I went to the doctor because I was dealing with the gout at the time. And I just go down there and give me some medicine like I've been doing all the time. And I got my lab report back and they called me and said that your number was off. My number said, you know, in people it go from zero to 7 point something, and then it go to one something. My creatinine was up to a two, my ketone was up to a two.
Mm,
So they want to know what's going on. But I tell people that sometimes when your kidney level go up, that don't mean that the kidney bad all the time. It could be something else going on with you. But you know, I feel bad. Just think about it, Sean. You know, all this time me and my sister and I growed up with mother on Dallas,
mm-hmm.
and we knew what was going on. We seen what was going on, and then for us to turn around and they tell me that hey, you have kidney disease, and they tell my sister you in kidney failure, you got to get on. That traumatized us. That scared us because we already seen it firsthand what it can do, and so that was just a devastation. Cause like I said, when we were younger, she used to take us to the doctor to get our kidney checked because she wanted to make sure, But like I said, we was living our everyday life. We didn't think about, my sister and I, we didn't think about no kidney disease, no kidney failure, no nothing besides our mother being on there. But for just we thought we were gonna get it. Now we wouldn't thought that in a million years.
Mm. Now, normally when something when something traumatic like that happens to any human being, especially at a young age, like I had a friend who had a heart transplant, I believe I was telling you about, and you're telling me with kidney failure, you start to question. You might question God, and I know they say we're not supposed to question God, but at that age, you might want to start questioning. Did you go through doubts or any questions with that man upstairs when that happened to you?
Well, the thing about it is, when it when it come to God, we can ask questions. You know, we can't blaspheme or curse him or nothing like that.
Mm-hmm.
That's wrong. But he do give us he'll give us a pass for just asking. And the thing about it is, you know, first of all, when I see my mother go through this, first of all, that messed me up.
Mm-hmm.
And then second of all, being a man and can't do what you usually do. You got young kids, and all I'm thinking about is I got a young daughter at the time. I ain't gonna be able to play with her. I ain't gonna be able to do this. Somebody had to go. Somebody had to take care of me. Somebody had to do this and that. So yeah, it'll go through your mind. A lot of people have told me, they're asking God, what's going on? Why me?
Mm-hmm.
So that's part okay because David and them in the Bible they ask questions. But the thing about it is you can't blaspheme.
Mm.
You know. But it don't matter what a person go through. They'll think about that. God, why me? Why I got to go through this?
So when we were talking last time, I remember you were saying before you got your match and before you got the transplant, that in your head you wanted God to heal your kidney, and you were in somewhat of I don't want to say denial, but you was hoping that God would heal your kidney instead of getting a kidney transplant. So in that interim period while you were waiting, what was like a plan of action that you took, whether it was a diet regimen, whether it was medicine, dealing with the doctor? What was your plan of action before you got the transplant?
Well, Deshaun, I'm gonna go back on me. Um, you can't say in a sense you can't say denial.
Okay.
You can't say denial, and I hear a lot of people say that. One thing about it, I knew what was going on,
Mm-hmm.
and like I said, mine was a long process.
Okay.
Mine was a long process. As long as I got diagnosed around about 98. I didn't
Mm.
get my transplant until 2013. So I had a
15
long,
years. Yeah.
yeah, yeah. So that's what they do. They try to prolong you getting on dialysis as long as possible. But close to like 2011 and 12, that's when I started feeling it being right. So me, Deshaun, I made up my mind that I wasn't gonna get on dialysis.
Mm.
And I tell people the truth because I look at people all the time, Deshaun, and they can't wait to get a kidney. But in the beginning, that wasn't me. I didn't want no kidney. I wanted God to heal my kidney that I was born with. And I started getting sick from it. And I look up, and I Google something. And I said, well, okay, this is why I'm feeling like this. This is why I'm feeling like this. I was in denial, but I knew it was kidney.
Hey, cuz man, when we be going on Google, man, that Google be putting it right in our face.
Yeah, yeah. That's why I tell my kids stay out of Google.
It
But
scare you.
yeah, but I'm just saying, Sean, I was an angry guy. I was an angry guy, cuz, and I used to work at the University of Mississippi. I had to get up at 1 or 2 o'clock in the morning. Be at work at 3. I had to clean buildings by myself, man. So I ran from the doctor. I didn't want to go to a doctor because I skipped my appointment. The nurse had to call and say, "Hey, please let us help you. Please let us help you." And and uh and I thought that the doctor was just trying to throw me on dialysis,
Uh,
really. And I had my kidney transplant. I had to go back and apologize to him. But I say that the people that I was working with, this lady and her daughter, they said, "Well, we know a doctor in Memphis." To answer your question, we know a doctor in Memphis. So when I went up there, and they say he gonna help me. So sometimes you can be listening at people, and ain't nothing gonna happen, but you just want that hope. So I went up there, he checked my kidney. He was like, "Man, your kidney are shrinking. They small." And he said that, and I couldn't eat. I stopped eating completely. And he gave me something like a herbal, something herbal. He wrote it on a piece of paper, and he said, "I want you to order this. I want you to order this," but I lost the paper.
mm,
And then the at the Whole Food store, you can get them in Walmart now. Them cranberries that you put in the blender. I just
yes.
put them in the blender. He told me to drink a lot, so I was trying that. Once again, Sean, in denial, I go to a doctor. I get my number checked, and it might drop down a couple numbers. So I'm like, okay, yeah, yeah, that's it's working, but it wasn't working.
Mm,
And that's why I tell people, like on TikTok, like when they come to you and say, okay, we got some of these herbals. The herbals can work for something else, but when you have chronic kidney disease, that's not going to work because you cannot reverse that.
thank you for bringing that up because that was like the next question I was going to ask you. And I want to be respectful to people's beliefs out there because some people's really into holistic medicine and herbs and
Right,
stuff like that.
right, right, right,
But we
right.
got to be very clear in this information because this could help somebody. So for the people out there that thinks if they're dealing with chronic kidney disease or kidney failure that they can reverse it by herbs, I need you to be very clear and let them know about holistic medicine with kidney failure.
Like I said to Chuck, I'm not knocking it. It can
Hmm.
work for something else.
Okay.
But when you have chronic kidney disease, you have scar tissues in your kidney. You have scar tissues, and you can't reverse that.
Mm,
You have to get a transplant, or you have to go on dialysis. You cannot reverse that. So, like I said, I'm not knocking what people sell or what it might work for some things, but see, just like when I was telling you about the doctor,
hmm.
and he was want me to get this medicine and stuff, but I lost the paper. I was gonna order it too. That just means Deshaun just hoping, but it wasn't gonna do nothing. It wasn't gonna change nothing, you know, because you like I said, you got scar tissues and different things, so it's not gonna do nothing to chronic kidney disease.
So for the people that's gonna watch this on the playback, I respect everybody's beliefs. But as my cousin Robert said, if you're dealing with kidney failure or chronic kidney disease, the holistic medicine might work for something else. But with this, you really have to abide by whatever your doctor treatment is. Because you don't want to put yourself in a bad situation and end up pretty much making the process making the process go worse because that's what it sounds like.
The reason why we tell people on TikTok and things, we have nurses, we have different people. The reason we tell it, Deshaun, because there's a lot of people that out there like me. I don't want to be on dialysis. I don't want to do this. I just want my kidneys. So I understand when people believe that.
Okay.
I understand when people believe that because you want some kind of hope. You know what I'm
Hmm.
saying? Because you got to understand, like you working or going by your everyday. I'm talking about every day, whatever you do, duty, go to work, deal with your family, and all of a sudden, you know, my leg hurting. You know, I can't get rid of this cough. I got the flu. I might well go to the doctor. And then you get in there and they said, did you know you're in kidney failure? What you mean I'm in kidney failure? Your kidney gone.
Mm.
You need to start on dialysis. So they got this thing they call a fistula
The pit in
to
your
put
arm.
in, right, put in your arm, but it got to grow.
Mm.
It have to grow. So but you need to be on dialysis right then. Sometimes they put it in your neck, like they did my sister. They put it in her neck until she started doing peritoneal dialysis. Then they put a tube in a stomach line. But I understand because I was the same way. And only people that I was dealing with, Deshaun, I wouldn't even listen to my wife because she was telling me the truth. But if I can talk to somebody and get them to agree with me, that's who I'm dealing with. But like I said, you know, I share with people. I did not want to get on dialysis. I didn't want a kidney transplant. I just got to be real. I was selfish, but good thing God wouldn't listen at me. You know what I'm saying? And God bless me with this kidney. You know.
So, do you remember the moment that you received the call about the kidney match? And can you take us through that?
Well, in 2013, I got a call on Mother's Day, and it was 5 in the morning. And like I said to Sean, I did not want the kidney. I did not want it. And man, I got so upset. I gave my wife the phone, and they said, "No, you need to give him back the phone because he need to tell us what he gonna do."
Mm.
And so we had to drive like 2.5, 3 hours to get down there. You got to let them know you got to go right then. So they hooked me up to Sean, get me ready for surgery. What I didn't know that when they call you, it might not be a match. They call different people. So listen, I want people to listen at this. They came in there, Deshaun, and they said, Mr. Ivy, it wasn't a match.
Mm.
Do you really know? Do you really want to know how I felt then?
How you felt,
Man,
cuz?
man, I was relieved because I'm saying I told y'all this was confirmation. I thought this was confirmation from God. He didn't give me this kidney, so there was confirmation. You know, I'm finna go back to work. I'm happy because he didn't give it to me. So that means that he gonna heal my kidney that I was born with. Fast forward to the end of July the same year, 2013. I was at church, and all of a sudden the pastor said, you know, we got different people going through things. Y'all just don't know. Where they stood one young lady up and said she had a heart transplant. Then they stood me up and they prayed for me. They said, we're gonna get a miracle. We're gonna get a miracle. Somebody gonna have a miracle this week. So went on to work that Monday, got out, went to bed by 8 o'clock, phone rang at 11 o'clock. I
Mm.
gotta get up, at one, someone who called me. But long story
Man,
short,
man, you at that, man, you probably wanted to turn the phone off, man. Like I gotta go back to sleep.
right. And Deshaun, I had a calmness. It was 11 o'clock at night. This time, man, I had a calmness that came over me. Man, I was happy. I wasn't mad about the kidney. Got down there by 2 something. They hooked me up that morning. They took me downstairs about 10 o'clock in the morning, and I was joking so much. I was just happy this day. It was different from the first kidney a month and a half ago. And God had calmed me down. He calmed me down. They said, "Let me give you something because you too hyper." Fast forward, when I woke up in the room, one of the doctor came in and said, "Mr. Ivy, you know what? I knew you was a good fella." Because I said, "Why you say that?" When I asked you how you were doing in the recovery room, they said, "I ain't sitting there, and I just started praising God." So that was him all the way. But I had to go back and apologize to my doctors and nursing staff because I really thought they weren't trying to help me, but they were.
Mm. So you talked about prior to you getting this kidney transplant and a second chance at life that you didn't want this to affect you at home with your wife and your children as a father and as a man. Can you talk about briefly the role that your wife and kids helped strengthen you during this journey?
You talking about having a kidney transplant?
During it or after both?
Well, well, Deshaun, sometime I'm just gonna say before, sometime when I'm just gonna say this, sometime hurt people.
Okay.
You understand what I'm saying?
Yep.
My wife seen me. I was already small, but she seen me wasting away.
Okay.
She'll tell me, Robert, if you gotta get on dialysis, you just got to do it. If you got to get a transplant, you got to do it. So at that point in time, I was just only thinking about myself. But they was in my corner, but she was scared because she know that the toxin and the poison set up in my body. If I don't do now one of them, and I'm not gonna be here too much longer. Fast forward after my transplant, her, my baby, my kid, they were there for me, and she had to get me up out of bed sometime at night, fix my medication and all that type of stuff. So, and I apologize to her because at that point in time, when you hurt, you just thinking about yourself. You're not thinking about you hurting a family member, and that's why I said sometimes hurt people. They're
Mm.
trying to help them, but you know, she was talking real. You know, a lot of more people was listening at me. Yeah, 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 Robert, you're right.
And
God can heal
and
your kidney.
wifey wasn't having it. She like,
She
man,
she she wasn't having it, but I wouldn't listen to her. But you just in the background and seeing somebody need to do something. If they don't do it, you know, they're gonna cost them. And that's what she was looking at, but I wasn't looking at that. And when you go through something like this, you got to have a support system. I see guys and women all the time on their own dialysis, TikTok of their family.
mm,
Our community is their family because they're going through this alone. And when they get on TikTok, I'm talking about they'll say, "Well, I don't have my wife died or my husband died. I don't have no, I don't have nobody else. It's just me." And so they get on TikTok, and that's our community. But like I said, I don't want to admit, man, I hurt. I apologize to my wife because she was trying to be there for me, and my mind was somewhere else.
takes a real man to admit that. Um, you said something important because I ran into a few people dealing with this as well. You talked about having a community. What are some advice to people out there that you would give them if they're lacking community while they're dealing with this?
Uh, like I say, you know, these days, Deshaun, we shouldn't be lacking no information. We got computers, we got the phone in our hand, we just have everything, man. And you know, get with a support group. If you're on TikTok, get with our community because we can't fix nothing, but we can give you some kind of hope. Because you have people going through and they still smiling. People wonder why they smiling and this and that. So you got to have some kind of support group. That's what I would tell them. You're gonna have to. And like in my community down in Mississippi, like you know, I don't have a whole gang of people that know about this disease. I done met more people that I'm close to on TikTok than
In
in
your
my
hometown,
community
yeah.
because my community don't know. They don't if it not hitting their family, if it not affecting them, they're not gonna talk about it. So I encourage people. I got a cousin. She's supposed to be getting on dialysis um, next couple months. On my sister husband's side, and she's scared to death. I said, well, your family can help you. They be your support system, but get on here and talk with us. I did a video last night, Deshaun, and it called "The Doctor Didn't Tell Me."
Hmm.
The doctor didn't tell me. And reason I made that video because a lot of people come on here and say, you know what, the doctor didn't tell me that. Why he didn't tell me that? Why he didn't tell me dialysis and high blood pressure can mess up the kidney?
Hmm.
And I understood what they were talking about because they didn't tell me about the side effects, the depression and the anxiety after I had my transplant. So that's what I'm saying. You're gonna have to get with a support group. You're gonna have to get on TikTok. Well, you're not on TikTok or Facebook. You're gonna have to find some kind of community that people were dealing with the same thing you are dealing with.
So now that you have a lot of knowledge dealing with kidney disease and you built a community, can you give some people out there any preventative measures? I know genetics play a part, but if there's anything that we can do to kind of prevent this from creeping up on us, what are some things that we should be trying to do in our personal life if our kidneys are fine to pretty much continue to be healthy?
Well, one thing that you have to watch the medication. You have to watch certain medication and over the counter pain pills and stuff like that. Because people with healthy kidney, if they take some of these pain medicine over a long period of time, it will mess your kidney up. Okay. Another thing, you don't have to go to a doctor every day or just go once a month, every 3 months, once a year. You know, so what we have to do, we have to what we try and do now, Deshaun, because a lot of people don't know. I didn't know all this information before. I didn't know all this information. So it come down to you have to treat your body like you treat your cars and things. You get your oil changed and change the tires. You have to do all those type of things. Keep the weight down.
I
It's
got to
some
do that. I
simple.
got 30 pounds I got to lose, cuz.
Man, I got the same thing. I got to lose. I got the same thing. I was down, then I go back up. But like I say, you have to watch your like your drink alcohol intake. You know, like I said, some pain pills over the period of time. If you keep taking them over the period of time, they mess a lot of people up
Mm.
about the medication. And if the doctor gives you some medication, you know, be the best to take your medication because the thing about it, Deshaun, I talked to a friend yesterday, and I said, man, I heard you was at the doctor's office. He said, yeah, man, I wasn't taking my blood pressure medicine. See, when the doctor puts you on blood pressure medicine or diabetes, because they are the two leading causes to kidney disease, and a lot of people admit and they say, Robert, I didn't take care of myself. I didn't take my medicine. So if you got high blood pressure out there, or diabetes, or any other thing, take your medication.
Okay.
That's the most important thing.
I'm glad you're saying that because, again, that's another thing that people run from. Even myself, I see a cardiologist and he tells me, Mr. Jones, you need to keep your weight down because you're starting to get up in age. And my blood pressure, it's over 120, but it's not above 140. So
Right,
it's manageable. But he said, man, if you
right.
if you creep past 150, man, you you're gonna be in some
Yes,
trouble. So
and a lot of people don't know. Sometimes people can feel their blood high and low. Sometimes you can't.
you
And
can't,
like
yeah.
like I said, Deshaun, the scary thing is when you go to a doctor for something else, or you go to a health fair and just say, I'm finna run this health fair on my break and come back. the next day they call you telling you, hey, you did start dialysis.
Yeah.
So, like I said, a lot of people they agree to it. You know, my sister tell them. One thing my sister tell people when they said, I don't like to play, I don't like to take high blood pressure medicine. And she said, do you see all the medicine that I have to take?
So you'd rather take one medicine and heal yourself than take all those medicines.
And I'm gonna tell you another thing that hurt men. Okay, I know you done heard about the high blood pressure messing with a man's nature.
Yeah, yeah, yeah.
Some men experience it. Sometimes it be in the mind,
Mm-hmm.
but some it hurt them, some it don't. But that's why a lot of men they don't like to take high blood pressure medicine.
Mm-hmm.
But I had a friend, the doctor put him on some blood pressure pills. Said, "Doctor gonna mess your nature up." So doctor said, "Which one you worried about, your nature or your organs?"
That's a bar, Rob. That's a bar, cuz. We got to think about the right. I know there's going to be a lot of men that's like, well, look, man, I'm with you on that. I'd rather
Right,
have my kidney. That can
right.
wait. That'll fix itself.
And you know how they, you can do it through blood now, but everybody, all the men know how they check your prostate.
Yep, yep.
A lot of men feel like they didn't go because they feel violated. Well, I told them, cause I'm going anyway because you know I'd rather go and get it done to find out, and that's how a lot of people have prostate cancer and don't know because they don't go and get them checked because they feel violated.
I'm glad you're bringing this up because my dad is older than you. And my
Right.
dad already told me, he said, son, for the people out there, my father is Rob's cousin as well. He's my cousin. They're pretty much first cousins. So
Yeah, we first cousins.
yeah. So my dad already told me, he said, son, look, I don't care what they telling you out there. You getting yourself checked because I got myself checked. My dad's 6'3". He's a big dude. But he said it's the best thing he ever did because now he knows. He knows he's healthy. And he's been going every year, not every year, but whatever it is, every 2 years since he's 50. And my dad turns, if I'm 30, yeah, my dad just turned 60. So he hasn't missed a checkup. So I'm glad you're bringing that up because I heard that foolishness within our community.
Yes.
Oh, ain't nobody touching me. And look, you get past 45, if God blesses you to live that long, you're going to want to live a little longer and be
Right.
healthy about it. So, man, look, I'm going when it's my time. I'll just say that.
Right. Yes. 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 And like I said, it's so much happening now, Deshaun, on what we eat and different things like that. And and like I said, I'm gonna keep pushing this. And I like to tell people, Deshaun, I'm not when I tell people about checkups, I'm not putting people down. I'm not trying to force them because back then I didn't do it.
Mm-hmm.
But what I'm telling people, don't be forced to go like I did. I was forced to go when they found out about my kidney disease, high blood pressure. I was forced to go back and forth to the doctor. I'm forced to go now because I got my kidney transplant and they got to keep an eye on my kidney. So I don't have a choice but to go. I'm not putting people down. I'm just telling them if something going on with you, it don't have to be kidney related, but something going on with you, sometimes the doctor can catch it in time. And that's what messes up. Sometimes we try to diagnose ourselves and we go when we are forced to go, when we too sick and
And
we
it's too
forced to
late.
go.
Yeah.
You see what I'm saying?
It's just like the dentist. Like I had to make sure last year to get all my dental checkups because oral hygiene is important. And even now with the other side of my mouth, I already set an appointment. Like we wait to the last minute and then we hollering in the house because we got an infection. It's too late then.
The dentist told me one time, I would get my teeth cleaned, and they said, I'm glad you come to get your teeth cleaned. He said, because people don't understand when you have infection, when you have different things going on in your mouth, that's affect
The
your
organs.
body.
Yep.
It can cause heart disease. It can cause your mouth not getting it clean.
Hmm.
It can cause diseases within your body.
Yeah, I'm already
Yeah.
on that. Here's another question because I know this might be a reason that people skip out on checkups. Everybody's dealing with insurance issues, especially with this economy. What role does insurance play with dialysis or getting checked up? Because some people might say, well, I don't have a job or I'm going through an insurance issue, a health insurance issue. Is there ways around that for people who are unemployed? Does Medicaid cover that with dialysis treatment and so forth?
Well, Deshaun, I hear a lot of people say that, and sometimes they don't tell me the reason what's going on, but insurance can play a big part in, like myself and my sister. We were blessed,
Okay.
and we was talking to this lady yesterday, and they was telling her that she need to go and talk to her coordinator, the Social Security people, because when you get a kidney, they want you to stay around that area for about 4 weeks at least. They want you to stay around the area, and she said that she had to, as long as she stayed there, she had to pay $30 a day for housing.
Mm,
Well, I told her that I didn't have to pay nothing, but we had a baby, so every week, me and my wife, we would drive to Jackson. My sister, she stayed in Alabama for 4 weeks because her son, well, he was grown. But anyway, a lot of people, insurance do play a lot of a role in it with kidney dialysis and stuff like that. It play a lot of roles. So it's you have to get some information from different people that know. Like my wife, she knew about Social Security. She knew about this and that, how to get help. There's some help out there, but we just uneducated, you know. And that's why I have people come on my platform and they'll say, well, you need to call this person, you need to call this person. Call it be some funds out there to help.
mm.
But a lot of time we just don't know, you know, and if you don't have any insurance, man, I just don't know. I don't think that they're going to happen, but I believe that you can get some programs. It's like I said, it's a lot of stuff out there that we just uneducated about it, and one thing about getting a kidney transplant, when they're gonna take at least about 20 pints of blood, and I tell you what,
It's a lot.
you got to be squeaky clean. If you're not squeaky clean, you're not getting that kidney.
Pretty much what you're saying to the people out there that's gonna watch this on a playback.
Yeah.
The second your doctor tells you you have chronic kidney disease or you're in kidney failure, if you want to survive long term, you gonna have to pay all that. And we're not shaming anybody, but you gonna have to pay all that liquor and weed down. That's what
I
it
mean,
sound. That's what it sound like you saying.
yep. I mean, it's like this right here, Deshaun. When it comes to that, anything in moderation
Yeah.
is okay. Like my doctor told me, I want you to get back to your life. You can drink, but you can't overindulge in things. And if you look it up, it's some things that you know smoking, excessive drinking, and different things like that. But I want to name a couple of things that they can look for.
Okay.
Like when you have a lot of protein in your urine.
It's crazy that you said that. I'm sorry to stop you.
Go ahead.
I remember when I was a kid, 10 or 11, and I went to the doctor and they scared the crap out of my parents and me. They said we done ran your son blood or urine twice and his protein was so high. And they didn't know my parents didn't have the information, but they was like, oh, what does that mean? Is he going to be able to have kids? But I remember hearing that, but go ahead.
And sometimes I'm gonna use this example. You know how people pour beer in a glass?
Yeah, yeah,
Do you know how it foams up?
yeah.
That's how the urine look.
When you have
That's
kidney
that
problems.
that's one of the signs because you know people don't understand the show. They just think kidney just filter your blood. You know what I'm saying? Kidney do a lot of things, and when your kidney start failing, we already know that the waste that's supposed to be urine is not going to be urine because your kidney can't filter that. So all that stuff going to build up in your blood, and it's going to cause toxin and poison.
Mm.
And uh, like I said, and it can cause some more problems, heart disease. You know what I'm saying? When people, a lot of people get, not everybody, a lot of people get on dialysis. They have heart problems. They have a lot of things going on with them. You know, they have a lot of things going on with them. So, like I said, we just have to, swollen ankles, short of breath. You have fluid lung, vomiting, nauseated, overweight. You know, uh, uh, more output in urine, less output in urine.
Mm.
That's just some of the side effects. That's just some of the side effects.
So I believe I asked you last time, so I asked you again. In order to get a kidney transplant, somebody has to go through organ donation. What are your thoughts on organ donation? Maybe not for you, but for the community at large. Your thoughts on it?
I living donor. That's what we looking for. Because when I was growing up, it was like they still do it. They wait on people, deceased donors.
Yeah,
But I think living donor is better. I think living donor is better because you know you don't know when somebody gonna die. You don't know when if it's gonna be your blood type. So I think that a living donor is perfect. They can check the kidney out, but a lot of people they won't do it because they're afraid if they get their kidney away,
they won't
their
have.
other kidney gonna mess up. But that's just something that we're not educated about. When we think about that. So like I said, they do matches. Matter of fact, I didn't know until I reading up on it. A lot of people they wait on their doctor to tell them, but you can call a kidney transplant center and go to talk to them about getting on there. But some people they're not qualified to get on there.
Mm.
Like I said, they're gonna check all your blood. They're gonna evaluate you. If you have anything going on, they're not gonna do it until you get it fixed. But living donors are important to Sean because we have people die. We have a large amount of people die each year waiting on the kidney. So a living donor, yeah, we need them because you have more people getting on dialysis than just about more people dying. And what are the chances that a person gonna die and have your blood type?
Yeah, you're correct about that. Yeah.
All these people all around the world. What are the chances on that happening? Because back then when I was having, back found out I had it, you had a lot of people, but you didn't have that. You didn't have many they have now, so
Hmm.
they can kind of keep up with it. You know what I'm saying? But now, you got people starting dialysis every day, every week somewhere. So what are the chances of people just dying now with all these people needing a kidney?
So I want to touch on these last few questions dealing with what you do in your community to give back. So for the people who doesn't know, my cousin Robert Ivy, he has his own foundation within his community, and he does things every year by giving back and doing walks. So I want to give you the time to briefly talk about your foundation, the name of the foundation, what it stands for, and how you're helping give back to the people in the community.
Well, Deshaun, my foundation is named in honor of my late mother, Roberta Ivy. We use abbreviation on TikTok. Her abbreviation RJI, Kidney Awareness. So people they be thinking my name is RJ.
Mm.
But what I try to do videos. Next week, man, I'm just gonna hit up news people. I'm just gonna hit up news people. I do a lot of video trying to encourage people to get a checkup. We have a walk each year. We get a proceed back to the dialysis my mother was on for 35 years. And so last year I said, well, I want to start reaching more dialysis center in my area, in Mississippi. So we was able to donate money to the center here in Oxford, Mississippi, and about 45 minutes away in Sardis, Mississippi.
Okay, that's to the left or west, right?
Right, to the west. So that's we were able to donate. So what I would like to do one year, start up like a health fair. People come and get free screening. You have doctors and nurses. They come in and the nurses get your blood and things like that. Because, like I said, people they'll follow me and they appreciate what I'm doing, but they just don't know about it. You know what I'm saying? They just know a few people. We got a big old dialysis here. They just built, and people still don't know anything about it unless it hit their family member.
And that would be very important if you're able to do the free health screenings. That would be large for the Oxford area. I'm hoping that comes to fruition with that.
Right. Our foundation, we like to teach and educate people about this deadly disease. Like I said, I know a lot, but there's still a lot that I have to learn.
Mm-hmm.
And I'm learning a lot as myself being on TikTok in the community. I'm learning a lot too.
And one last thing, I saw that your foundation also does scholarships, that you was giving money back to school.
Well, when COVID hit, we stopped. But me and my wife talked about it. We're gonna start back. We have a county school and a city school.
Okay.
And what we was doing, we would go to each school. We'll tell them to write a essay. They'll write an essay from each school. We'll read it. We'll pick one, and we'll donate money toward their books.
Mm.
So we're gonna have to get back on that. It's one thing, Deshaun, I learned about social media, and this might be off topic about social media. Sometimes we can get caught up in likes and things like that. And that was my problem. I was off and on because I wasn't getting the likes. But when a person realizes that it's not about them,
yep.
And I found out through some people that they said, "Man, I might not hit the like button, but I'm watching."
Mm-hmm.
So I encourage people, if you're gonna do something, I don't
do
care
it
if
out
you
the
get
heart.
one like.
Yep.
I don't care if you get one like. It's somebody watching your story and you're helping someone out. When you take yourself out of the equation, you'll be and see the bigger picture. See, I take myself out and see the bigger picture. You know what I'm saying? So the reward gonna come later, but if I can reach one person, I'm doing my job.
I'm glad you say that, because I say that too with what I do in media. I say, whether it's one person that's going to watch this or 100 people, because for me, it's not about the likes.
Right.
Some people get caught up, oh, I didn't have 1,000 views.
Right.
I don't care if I got 5 views. I know this content is going to help somebody. So if
Right.
it helped one person, then we did our job.
And I wasn't helping people, Deshaun, because like I said, I was caught up in my own self, but I didn't get my mind right. And you have people that they would not share their story because they're not getting the likes,
Mm.
you know. And I try to encourage people to just keep going, you know what I'm saying? Because I feel like, you know, I didn't have a choice, Deshaun, you know. Like me and you can talk now, but when I was growing up, I couldn't talk in public. I can talk with my family and friends, but I couldn't stand up in church and talk and do none of this right here. So, you know, but God kept me here for a reason. You know, just think about it. I got a 13-year-old young man kid that accidentally got shot.
Mm.
So do you think he want me to sit down on it? I got to honor him too. I got to keep his
Mm.
legacy alive too. You know.
That's
So
that's a real big thing. So I'm glad you brought that up, and I guess we can end with here. Because there might be other people out there that feels that same way and don't know how to express it when they get an
right,
organ donation, whether it's a heart, a kidney, or whatever. Um, that you feel that you have to honor that person because they kind of gave you a second chance at life.
right. They family gave you a second chance, and I encourage anybody that going up for any kind of you know trans transplant, any kind of transplant where the heart. Don't get offended when the doctors say the family do not want to talk.
Okay.
You have some family they'll talk to you. You have some family just want to donate their loved one kidney, and they already hurt and they just want to donate. They don't want you to know their name. They just want to go by their business. And the doctor not gonna tell you anything more, but they will hook you and that person up that donate their loved one kidney. They will do that,
Mm.
but they'll tell you that they just want to give you the kidney. They don't want to talk about it, and that's their right.
Cousin Rob, man, I appreciate your time and I appreciate you doing this the second time for me,
Man,
man. I really
I
appreciate it.
appreciate you. Man, I do it a third time if you want me to. I appreciate you, cuz for
Yeah,
real.
because like I said, man, normally on my platform, as people who watch this, they know I do sports and stuff. But I said, man, nah, our health is just as important as that other stuff. Because if we
Right.
not healthy, all that sports and music ain't gonna matter. So with this being March, which is Kidney Awareness Month, I appreciate you sharing your testimony, sharing some information, and hopefully this will help somebody. Like you said, it's
Yeah.
not about the likes. Hopefully
Right.
this reaches one person when I put it out on TikTok or YouTube or whatever platform we put this out. I pray that this information reaches the right hand and the right heart and really helps somebody out there struggling with kidney failure or chronic kidney disease. So before we end this, Rob, how can people get in contact with you and your community on the social media channels?
Well, on TikTok, it got I got 662 Robert. That's my area code, 662 Robert. Facebook is Robert Ivy, and on TikTok is RJI Kidney Awareness Foundation.
Cousin Rob, man, it's a pleasure to talk to you. You know, I got nothing but love for you and all my Ivy family down in Mississippi. To the
Right.
whole Lafayette County and everybody down there, aunties, second and third cousins, and everybody down there. Much love to you guys.
Same way to y'all, cuz up there.
Definitely. All right. To the people that's going to watch this on the playback, appreciate you tuning in. You're with your host, Deshaun, aka Son of a Jones. And I had the pleasure of speaking with the survivor, my cousin Robert Ivy. Robert, man, continue to be blessed.
You too, man.
All right.